Anthrax occurs worldwide. It's sporadic after vaccination, and it's endemic in warmer countries. The bacteria is Bacillus anthracis. It's a gram-positive rod. It has metachromatic staining, so it has a pink capsule and blue bacteria. There are two clones. A makes up about 80% and B makes up about 20%. The antigens are the capsule, the cell wall, and the exotoxins. There are three: edema factor, lethal factor, and the protective antigen. The capsule has D-glutamate. It can't be decomposed by animals. For the epidemiology, it affects ruminants the most, especially sheep. And then it also affects cats and dogs and swine, but these are least susceptible. It affects humans too. It's a zoonotic agent. Bacteria exists in soil, pasture, and in water sources, and spores can come from the carcasses of dead animals. There is no vertical or horizontal transmission. The bacteria gets into the body orally, and then the primary replication happens in the throat and the gut. And then germination occurs, so these are vegetative bacterial spores in the gut. And then the toxin production occurs, and it causes local lesions. And then blood septicemia occurs, and D-glutamate can hide from white blood cells within the bloodstream. And then the lethal toxin gets into the central nervous system and inhibits the respiratory system in the brain. And then the animal will die from suffocation. In cattle, they get pure acute cases. They have dyspnea and central nervous system signs, and they also have bloody nasal discharge. Horses get foamy nasal discharge and colic. They also have acute cases. Swine are very resistant. They get local lesions in the intestinal tract, but they usually recover. And birds can get generalized fever and they get hemorrhagic diarrhea. In the pathology, we can see hemorrhages, edema, and congestion, and hemorrhagic enteritis. And when septicemia occurs, we can see incompleted clotted blood, which means it's dark blood, and an enlarged spleen. Dissection is very dangerous because one dissection is sufficient to expose bacteria to oxygen, and then sporulation can occur. For the diagnosis, you can do a PCR of the ear cartilage. And for treatment, you only treat them very early on if they have clinical signs. And you only vaccinate healthy animals with no clinical signs, and you use a live vaccine called the Stern strain. It is an anthrax bacteria without a capsule. There are 4 clinical forms in humans. There's cutaneous, which it gets in through wounds; pulmonary, so the spores are inhaled; there's GI, so they can eat infected meat; and there's also sepsis, which means the bacteria gets into the blood. It is an occupational disease, so vets and farmers are more likely to get it, and it can also be used as a biological warfare agent.